But there is an absolute determination in her to just maintain whatever she can in terms of that quality of life, to be involved in whatever parts of life she can. And sometimes, and she does go to hydro, and she gets to Scrabble occasionally, and a few, but it's a huge task for her because she can't talk to her mother anymore because her mother's largely deaf, and her voice is so soft that they can't communicate barely. And as I said, her husband's quite a handful, and I spent a bit of time talking to her about him. As I said, absolute determination. The other thing I think too that's really important, and lots over the years I hear people say, oh, I can't do this and I can't do that. And one of the things that is really important, I think, that we often forget is that the core issue for most of us in life is it's the relationships we have. And I hear parents say, oh, I can't do this with my kids, I can't kick the footy, or I can't do this, I can't do that. And I think that's, yeah, sad, true, but that's not the key issue. The key issue is that you can actually maintain the relationship. And that's true for all of us. Where, I would say to my dad when he was in his 80s, what would you like for Christmas? And he'd say, oh, nothing very much, I don't want stuff, just come and see me. Which is what's true for most of us. We actually involve, and the things we do are about the relationships. I mean, I did this run for the kids this morning, but what is it about? Yeah, okay, the run's fine, but it's with a group of people, and the people, that's what maintains my involvement. I like the people. I talk to I've got a group of friends that are involved in it, and so many of our activities are about the relationships, and so much of the quality of life is about relationships, because I think that one of the important bits, when at whatever level of a condition that you struggle with, is maintaining some stuff that gives you a sense of enjoyment of life, a sense of quality of life, a sense of involvement in things that help to expand your lifestyle rather than keep letting it shrink. And as I said, I've got up there, never ever give up. There's some of you. I renovated recently and I can't find the cartoon, but there's a great cartoon with the water bird standing in the swamp, and it's classic, it's been around for years and years and years. And the water bird has got there's something in the water bird's mouth, it looks like a frog, and it's got its arms out around the water bird's neck, holding it really tightly, and there's no way that critter is going down that water bird's neck. And the caption underneath it says, never ever give up. And I really like it because, as I said up there, if you give up, you lose. At whatever level that you can maintain some involvement, some interest, some activities, then do it for your own sake. Because if you drop the ball, then you lose, in a sense. You end up with your life collapsing down. Now, there are all sorts of levels, but finding stuff that makes a difference is really important. Antidepressants, yeah, good value. They make a huge difference to people. Some people say, no, don't want to know about it, and that's fine, and they end up coming along to see me and saying, I don't want to take any antidepressants, so what can you do to help me?
Respond blue, I see you. Respond blue.
I see,
Respond blue, I see you.
The problem as I see with antidepressants, or the only problem I see with antidepressants is that, and I've talked to some psychiatrists along the way about this, that there's no way you can predict which one of the antidepressants is the right one. So I've seen people who take this one and it doesn't seem to help, they take that one, it doesn't seem to help, they take that one, and within an hour or so they feel physically awful, and they just chop it, and they take that one, and 3 or 4 days or a week or two later, and they're just different, they lift. And a lot of the stuff, the sleep issues and a lot of those things resolve, and they just feel better. So the antidepressants can be really valuable and make a huge difference to people. The other thing I often think or do is, the view I take, I guess, is often practical solutions are really important for people. I have a little lady, she's suffers with chronic pain, back problems. She really struggles. She lives on her own. She came into a little bit of money recently, and she struggled with being depressed, limited, can't get out of her house much because the shops are quite a long way. She has someone comes in and does the shopping, but she tends to be a bit locked in. She got some money come along, and she acquired a scooter. All of a sudden her life has gone boom again, because she can now get down to the RSL, she can get down to the shops, she can go and have a coffee, she can do things. And lots of the solutions, especially for people such as yourself, who have probably coped with most of life quite well, and then run into something that has really knocked your socks off. It's not that you need lots of, from my perspective, that you need your head shrunk in a big way. It's just finding solutions that work from a practical perspective. And that's one of the things that I go looking for. What difference can you make in this person's life that lifts them, that helps them to feel better, to feel like they're involved in something that they enjoy doing? Assistance, lots of places. Most people, sorry I didn't go through the spelling thing, and that's why those are underlined. The family doctors is the first port of call for pretty much everything, basically, local GPs. Community health centres, they're quite good sometimes, in the sense that they often have psychologists, social workers, counsellors of various kinds on tap that are able to assist. Public hospitals vary a bit in the sense of what services they offer in this area. Most of them have a psychiatry department, and they should be able to provide some assistance. Beyond Blue is a great website for those who have an interest. It covers all of this stuff and more, and certainly in terms of referrals and places to look for help will provide you, and also some questionnaires to determine if you actually are depressed. So they'll you fill out a questionnaire and it shoots off the website, comes back with a score and says yes you are, no you're not, or maybe, or whatever. So that's sometimes worth doing. Psychiatrists, of course, been around for a very long time, do a great job with helping people with depression, tend to be more medication-based. And for anyone who's not sure, the difference between a psychiatrist and a psychologist, psychiatry is a medical specialty, so they train as doctors and then do a diploma of psychological medicine, so they're able to prescribe. Psychologists, my training is a degree in psychology and a master's degree in psychology, which is really just about talking to people, because we can't prescribe, and I'm quite pleased that we can't really. Psychologists, just spend a lot of time chatting, hopefully with purpose, but talking. Because I know about this, the Australian Psych Society, there's a number there in the phone book, and they're the sort of the equivalent of the Australian Medical Association, I guess. They're the professional body that looks after psychologists. They have a referral service. I actually use it quite often. If someone rings up and says, look, I've got a problem with my son or whatever, can you help me? And it's not an area I work in, so I say, let me track down some resources, and I ring them up and say, hey, look, we've got someone in Cranbourne who needs to see someone. This is the nature of the problem, and they'll give me 2 or 3 names. There's no recommendation in that. It's just that these are the people in this area that say they can help. And that's what it is, because every year I put my name down on the list and I say, I do this, this and this. So it's not as if it's vetted in any way, but you'd be foolish to put down stuff that you can't do, of course, because you end up with egg on your face and upsetting patients. And social workers, there's a whole lot of social workers around, and you tend not to find them in private practice much, but certainly in the community health centres and public hospitals. The other thing perhaps I should say about psychologists is that the government, well the Howard government in fact, in the end of 2006 brought in Medicare coverage for psychologists. So psychiatry and psychology does have Medicare coverage. It requires a referral from your GP, and then there's a quite substantial rebate. another thing to say about psychologists in that area is there are two groups. There are psychologists, and then there are clinical psychologists. And for some reason the government's made a difference, and you get more back for seeing a clinical psychologist than you do a psychologist. So keep that in mind when you're thinking about that with your GP. Why did I hold it there? Because I sort of covered sorry, that's my son and his mate and his mate. On top of Mad Buffalo a year ago. this ugly one over here is my son.
In the back, sorry.
And about his age, I had about that much.